This is Kathy Knipfer, instructor for Nursing 2333, recording the Managing Nursing Care lecture for Chapter 23 on Conflict, the Cutting Edge of Change. Conflict is a disagreement in values or beliefs within oneself or between people that causes harm or the potential to cause harm. It can be a catalyst for change, and it has the ability to stimulate either detrimental or beneficial effects. Let's go over types of conflict. Intrapersonal conflict occurs within a person when they're confronted with the need to think or act in a way that seems at odds with one's sense of self. Interpersonal conflict is the most common type of conflict, and it transpires between and among patients, family members, nurses, physicians, and members of other departments. Conflicts occur that focus on a difference of opinion or priority or the approach with others. Organizational conflict occurs when there is discord about policies and procedures, or personnel codes of conduct, or accepted norms of behavior and patterns of communication. Some of the conflict, which is organizational, is related to hierarchical structure and role differentiation among employees. To better understand stress and conflict, there are some important factors that we should consider. One is the context, such as the particular work environment. Also, the extent to which leaders respect staff concerns. Cultures that condone shame and blame. The use of compromise to avoid dealing with the conflict. And understanding that unresolved stress leads to poor patient outcomes. The stages of conflict. The first stage is frustration. When people or groups perceive that their goals may be blocked, they feel frustrated, and this can escalate into a stronger emotion, such as when people become angry or just give up. Have you ever seen someone get angry over nothing? If you have, then you have seen a misunderstanding based on someone's inability to gauge the situation accurately. Just suppose you did not discuss a patient's treatment plan or care plan with him or her, and when the patient does not carry out his or her part of the plan, you label this patient as non-compliant and feel frustrated that the patient is uncooperative, when in all likelihood the patient had a completely different set of priorities at the start from those of the nurse. At the same time, the patient may view the nurse as controlling and insensitive. When such frustrations occur, it is acute to stop and clarify the nature of the major differences and make sure everyone is on the same page. The next stage is conceptualization. That's where we have a mental picture of what has happened. So when we see or we're confronted with something, our mind forms a mental judgment about what actually happened. Everyone involved has an individual interpretation of what the conflict is and why it is occurring. Most often, these interpretations are different and involve the person's own perspective, which is based on personal values, beliefs, and culture. The way the individuals perceive and define the conflict has a great deal of influence on how creative those involved may be in trying to resolve the problem and what type of outcomes can come about. The third stage is action, and the fourth stage is outcomes. Modes of conflict resolution include avoiding, accommodating, competing, compromising, and collaborating. Each of us should assess how we handle conflict. If you tend to use avoidance often, ask yourself these questions. Do people have difficulty getting my input and understanding my view? Do I block cooperative efforts to resolve issues? Am I distancing myself from significant others? Are important issues being left unidentified and unresolved? If you seldom use avoidance, ask yourself, Do I find myself overwhelmed by a large number of conflicts and a need to say no? Do I assert myself even when things do not matter that much? Do others view me as an aggressor? Do I lack a clear view of what my priorities are? Do I stir up conflicts and fights? If you use accommodation often, ask yourself these questions. Do I feel that my needs, goals, concerns, and ideas are not being considered by others? Am I depriving myself of influence, recognition, and respect? When I am in charge, is discipline lax? Do I think people are using me? If you seldom use accommodation, ask yourself these questions. Am I building goodwill with others during conflict? Do I admit when I've made a mistake? Do I know when to give in, or do I assert myself at all costs? Am I viewed as unreasonable or insensitive? If you use competing often, ask yourself these questions. Am I surrounded by people who agree with me all the time? Do people avoid confronting me? Are others afraid to share themselves and their needs for growth with me? Am I out to win at all costs? What are others saying about me? If you seldom use competing, ask yourself, how often do I avoid taking a strong stand and then feel powerless? Do I avoid taking a stand to escape risk? Am I fearful and unassertive to the point that important decisions are delayed and people suffer? If you use negotiation often, ask yourself, do I ignore large, important issues while trying to work out creative, practical compromise? Is gamemanship a part of my negotiations? Am I sincerely committed to compromise or negotiate solutions? If you seldom use negotiation, ask yourself, do I find it difficult to make concessions? Am I often engaged in strong disagreements, or do I withdraw when I see no way to get out? Do I feel embarrassed, sensitive, self conscious, or pressured to negotiate, compromise, and bargain? Benefits of compromise. One can think about and consider many things when selecting an approach to resolve conflict. They could be the nature of the differences, underlying reasons, importance of the issue, strength of feelings, commitment, and goals involved. Preferred and previously effective approaches can be considered, but they need to match the situation. Not everyone has the same experiences nor the memory of the same conflict. Sometimes a third party may be introduced into the conflict so that mediation can occur. Mediation is a learned skill for which advanced training and or certification is available. The mediator is usually an impartial helper who assists each party in the conflict to better hear and understand each other. Mediation is not so easy. Both sides must acknowledge disparities. It's not about winning or losing. The key is what works best in this situation. Now we'll go over the steps to resolving conflict. First, name the conflict and identify the problem. Identify your reaction to it. Search for the cause. Identify a common goal. Generate solutions. Select and plan innovative solutions. Implement, evaluate, and repeat as needed. Guidelines for confrontation. First, the need for confrontation needs to be identified. Timing is important. The problem should be clearly identified. One should identify required behavior, establish credibility, remain empathetic, avoid those personal attacks, and use genuine humor if appropriate. Managing lateral violence and bullying. Lateral violence is the aggressive and destructive behavior or psychological harassment of nurses against each other. Bullying is closely related to lateral or also called horizontal violence, but a real or perceived power differential exists between the instigator and the recipient. Self assessment regarding collaboration. If you tend to collaborate often, ask yourself, do I spend valuable group time and energy on issues that do not warrant or deserve it? Do I postpone needed action to get consensus and avoid making key decisions? When I initiate collaboration, do others respond in a genuine way? Does the group exhibit hidden agendas, unspoken hostilities, and or manipulation? If you seldom use collaboration, ask yourself, do I ignore opportunities to cooperate, take risks, and creatively confront conflict? Do I tend to be pessimistic, distrusting, withdrawing, and or competitive? Am I involving others in important decisions, eliciting commitment and empowering them? You can assess the degree of conflict resolution by asking questions about the quality of the decisions, such as creativity, practicality, achievement of goals, and breakthrough results. You also would want to assess the quality of the relationships, such as understanding, willingness to work together, mutual respect, and cooperation. So, as an individual exercise, I would like for you to consider a conflict that you would describe as ongoing in a clinical setting. Talk to some people who have been around for a while to get their historical perspective on the issue. Then consider the following questions. What are their positions and years of experience? How are resources, time, and personnel wasted on mismanaging this issue? What blocks the effective management of this issue? What currently aids in its management? What new things and actions would improve its management in the future?